My name is Serhii SKRYPYNETS. I am a psychotherapist, a PhD student in psychology at Uzhhorod National University. Accredited practitioner and consultant in EMDR, training teacher in Mindful Self-Compassion 2. My academic advisor is Professor Uliana Mikhalish. The topic of my presentation is Mindfulness Self-Compassion in the work of the trauma-focused therapist with complex cases. I want to share a clinical observation about a difficult moment in trauma-focused work. Imagine a client. He describes many problems at once: anxiety, loneliness, conflict at work, the loss of his home, debts. The therapist tries to focus on one topic. The client moves to another. A second attempt, the client becomes sad. A third attempt, he becomes irritated. In the therapist's body, the chest tightens. A hot chaos in the head. A thought, I did not study enough. An impulse to end the session, or to randomly offer at least some technique. This sudden cascade of reactions in the therapist when meeting the client's helplessness. I call the therapist's shockwave. Unlike vicarious traumatization or compassion fatigue, which build up slowly, the shockwave happens within one session. And it needs immediate self-regulation. And the clinical state of the client that triggers it I call multiple crisis. In a state of multiple crisis, therapists fall into one of two traps. First, techniciization, a chaotic choice of technique under the pressure of do something. It looks protocol-driven, but it is an escape into technique from the feeling of helplessness. Second, compassionate joining in helplessness, validation without structure. It looks empathic, but it is also an escape, this time from the anxiety of action. Both extremes share one thing. The therapist is trying to cope with his own shockwave, not with the client's situation. Mindful self-compassion offers a third way. According to Christine Neff, it has three components: mindfulness of the moment, to notice the shockwave without merging with it; common humanity, the recognition that the client's situation and our own limits as therapists are typical human experience; self-kindness, an inner position, I do what I can and this is enough. From this, one practitioner principle stands out. I call it the help me understand principle. It works on two levels. Inside, the therapist holds this position. I know my work, how to work with trauma. But without your voice, I cannot know what is most present for you right now. And in moments of greatest confusion, the therapist says it aloud. Help me understand your experience, and together we will choose the starting point. Expert responsibility stays with the therapist. What is delegated is only the client knows best, his own experience. The principle is not used in cases of early parentification, in acute decompensation, or in child therapy. When I notice the session going in a flow of complaints, I follow 5 steps. First, notice my own shockwave. Second, a short self-compassion pause. Third, validate the client's not knowing. Fourth, invite him to formulate the request with me. Fifth, choose the most accessible goal, not the most important. Multiple crisis is not solved by a hasty protocol and not by compassion alone. Mindful self-compassion offers an inner frame to regulate the shockwave and at the same time keep clinical structure. They help me understand the principle turns the session into joint work without shifting responsibility onto the client. This way, the bridge between humanity and effectiveness is preserved, and therapists themselves are protected from burnout. Thank you.